So I'm just going to start by welcoming Dr. Meckelberg and Dr. Hill Moses. I'm really glad you guys could both join us, and I really appreciate you being here tonight, as well as those of you that have signed on for this session. So this is my third session, lucky number 3, and it's our Ask Me Anything, which the name kind of explains it all. You guys have 1 hour to ask these docs any questions that you have. You can submit your questions anonymously. At the bottom, there's a box that gives you the Q&A. No one's going to know it's you. So this is kind of a unique opportunity for you guys as dental students. Please don't hold back, fire away with your questions. And then just to kind of start us off here, for those of you that don't know me, my name is Molly Lang. I work in academic and industry relations with Aspen Dental. And Aspen Dental Management is a partner to those Aspen Dental branded practices that you guys probably have seen. And we provide all of the non-clinical care for those practices. So at this point, we are the largest branded DSO across the nation. So that's a little bit about ADMI. I do want to welcome our docs by having them introduce themselves. So Dr. Meckelberg, maybe you can start us off.
Most definitely. I am Dr. Brandon Meckelberg. I started with Aspen in the end of 2017, and I currently practice and own practices in Panama City Beach all the way through to Tallahassee, which is where I'm located right now. Originally from Wisconsin, I went to dental school at Marquette University in Milwaukee and did my undergrad at the University of Chicago. So I'm a Midwestern guy. Eventually found my way down to Florida via Aspen and have never really looked back since. I definitely don't mind the winters down here. Much prefer them to the cold up off of the lake effect in Chicago and Milwaukee. So.
Very nice. Thank you, Dr. Meckelberg. And Dr. Anna Hill Moses, can you introduce yourself and tell the group a little bit about your story?
Sure. So I'm Anna Hill Moses. I graduated in 2019, so I've been practicing for about a year now. I originally am from Connecticut, and then I found my way down south via Teach for America, actually. So I did that for 2 years prior to going to dental school at the University of Tennessee. I have family in Tampa, so I knew this is where I wanted to end up. Similar, I was done with the snow and the coldness and enjoy the warm summers down here. And I just transitioned into a new practice as an associate dentist in Plant City, Florida.
Very nice. Great. Well, thank you guys both so much for being here again tonight. I want to start off, I'll tell you guys a little bit about the students that are here. These are LECOM students. They're in their 4th year, which both of you guys have been there. And they're probably weighing their options of what they want to do right now. So I thought that the best way to start off the session was to ask both of you, what made you choose Aspen Dental over all of your other options, whether it was residency, private practice, or other DSOs? And again, maybe Dr. Meckelberg, you can start us off.
Definitely. So when I came out, I actually was even before I came out, throughout all of dental school, I was completely anti-DSO. I thought there was no way in a million years that I was going to work for one of the DSOs. I wanted to do my own thing and create my own brand, work in a cosmetic practice, do all these different things. Right after I graduated, I had an opportunity in downtown Chicago, went and took that opportunity, and I realized really quickly that it wasn't all it was cracked up to be. In the private practice setting, I just felt like my growth potential was stunted, or I didn't have a lot of potential coming out. I was in an associate role that there wasn't much for partnership or ownership anytime soon. And I wanted to really pursue my passions of being able to manage a practice and manage staff and teams and really build a culture within an office. And I was limited on that. I couldn't do that. So I reached out and had a connection with an individual up in the Chicagoland area, interviewed at an Aspen practice, went in, and my mind was like blown. When I went in for the first time, I was like, this is not a DSO. This is really what what they always are harping on and saying is like the most evil thing from all the professors in school. That's what they were telling us. Stay away, stay away. I got in and I loved it. I loved the team. I loved the culture. I loved the atmosphere. It's definitely fast paced. It's not like you see a patient and you sit and hang out for 20 minutes and then go see another patient. Like it has a flow to it. But you're allowed, the model that's in place allows you to help a lot more people than you would otherwise. So long story short, I ended up joining and have never really looked back since. I wouldn't be living here in Florida and wouldn't be in this position right now if it wasn't for teaming up with Aspen. So I'm definitely thankful for that.
Great. And that wasn't that long ago. You were a 2017 grad from Marquette, correct?
Yeah, so I graduated in 2017. This all kind of fell into place in late 2017. And actually at the very end of that year, I moved to Florida. I took over this practice in Tallahassee and ended up buying this practice in, I believe, like early 2018, and then ended up growing since, ended up buying more practices in this region of Florida. So like I was saying before, my practices span right now from Tallahassee over to Panama City Beach, with opportunities all in between. And we're looking to grow a little bit outside of that, maybe even go expand towards the 30A Sandestin area, which is gorgeous for all of you guys that are, obviously, if you're in LECOM, you guys know that very well. So that's kind of what's on the plate in my future, hopefully.
Very cool. Great. Thank you. And I want to get back to some of that later on too, because I think you have a really interesting story. You're still quite a young guy and you own a couple of practices, and I'm sure the group is going to have some questions, guys. Throw some questions at Dr. Meckelberg. If you're interested to hear a little bit more, but we'll come back to that. Dr. Hilmoses, I've been with you since you started with Aspen, so maybe you can tell these guys a little bit about your story of why you chose Aspen Dental over some of the other options that you had.
Sure. So my goal, literally since I was 3, was to be a dentist. I wanted to be a general dentist. So I knew that I wasn't going to look at residency afterwards, and that my main goal was to treat as, I'm so sorry, my cat just joined us. Here she is. Anyways, my main goal was to see as many patients and treat them with as much care as possible. So I was really open to a ton of different options. And I'm sorry, we'll just let it go. So I did interview with a private group practice, a single doc private practice, as well as other DSOs. For me, location was really important. My grandmother, my aunts and uncles, my cousins are all in Tampa. So I knew I wanted to be here. And my number one thing as a general dentist is I know outside of school, I was gonna have a ton of questions. So I wanted to find a really good mentor and somebody who was actually going to take the time to, you know, hold my hands if I wanted that, but also give me that big leash if I needed it. And so when I interviewed, I was just kind of going off of personality. And I found that I just meshed really, really well with Dr. Dickerson and Dr. Liu, who are the owners in the Tampa area. And what's been super awesome is working with both of them. I think both of them have their different strengths, and obviously dentistry is not black and white, so they have different ways that they would treatment plan things, and we talk that out. And I just love that there's a really big network here in Tampa with Aspen, that they own the 14 practices. So I can text either them or another doc and just say, hey, what would you do with this? So I was really looking for some good mentorship.
That's great. Thank you, Dr. Hilmoses. And here's a question for both of you kind of leading into that. You know, how important, Dr. Meckelberg, you mentioned that you went and interviewed in a few different places, and Dr. Hilmoses, you did too. How important would you guys say it is for these dental students to interview in a few different places or maybe shadow different docs? Did that kind of help you narrow in on what you did want, or do you wish maybe you had done that differently and seen more dental practices?
I definitely shadowed a lot, and in different, you know, DSO versus private practice, a group practice versus a single doc. And I think that helped me realize that I I'm definitely a busybody and I want things to do. I don't want to just like see a patient and then sit down. I like to be doing multiple things at different times and, you know, always on my feet rather than just showing up to work and sitting down. So I think it's helpful to see different flows of different types of offices for sure.
Dr.
Yeah, I totally agree. Totally agree with you. I think that's one of the biggest encouragements that I have for anybody coming out of school. Go test the waters in a lot of different places. Go shadow docs. Go ask them the good and the bad. Don't just get the highlight reel. When you go and shadow them, don't just shadow them for like 20, 30 minutes. Make sure you spend, you know, a majority of the day with them and really see how things flow and see if it's somewhere that you see yourself, whether that's with Aspen, whether that's with a private practice, whether that's in a group practice, whether that's in a residency. I think it's really important to see those things because you hear all these different tales from different people in all different directions. And until you see it for yourself and really experience what you're going into, you won't know. And the other part of that I would encourage is making that connection with individual, like you had talked about, Doc, was you made that connection with the Dickersons. I think that's super important to have that connection with the doctor that's going to be mentoring you. You got to know that you're going to be that's going to be someone that's going to connect with you well and want to groom you and coach you and build you up and allow you to really grow into what your aspirations are and what your ultimate goals are, and not somebody that's just going to bring you in there and use you as a, you know, kind of a turn and burn and someone that's going to be sitting there doing fillings all day. Instead, you want to be able to have those growth opportunities and really expand your dental base. And even outside of that, if you have aspirations of you know, clinical management, partnership, ownership, whatever it is.
Yeah, kind of piggybacking off of that. One thing I would definitely do is see if you can talk a treatment plan out with whoever, you know, you're interviewing with and see how they are going to coach you, because that's the person you're going to turn to on your greatest days, but also your roughest days. It's not every day is perfect. So you're going to want to see how can they encourage you? And is that the type of support that is actually going to encourage you to be the best version of yourself?
That's a great point, Dr. Hill-Moses. And actually, we got a question in from one of the students who was asking about that exact thing, treatment planning. You do hear that with certain DSOs, there's not autonomy around treatment planning your patients. Can you guys talk a little bit about that? I mean, I know both of you heard that in dental school. Is that what's the truth? Do you have autonomy over your treatment plans? Can you, maybe Dr. Meckelberg, maybe you can take this one first, and then Dr. Hill-Moses?
Yeah, most definitely. As clinicians, we have 100% autonomy over our treatment plans. That was a myth that I had heard for a long time that I didn't believe until I actually got into practice and saw it for myself. But we are the clinicians. We're the ones that we're the professionals. We're the ones diagnosing. We're the ones that are responsible for these patients, and how we treat these patients is up to us. You know, I will tell you, in my practices, I offer mentorship to my doctors, but I don't tell them they have to do things a certain way. And if they want a treatment plan and follow through with a case differently than how I would see it done, I offer my opinions on it and why I would do it the way I want to do it. But if they prefer to do that way, then they do it that way. And I think that's really the key. There's no one over us, though, that's saying you have to do things a certain way. And there's no quotas. There's no anything behind it. We just try to do things that are going to, all our decisions should be based off of what's best for the patient. And as long as we're doing that, we're going to be successful.
I think that's a concern that a lot of dental students have, because it is a myth that's out there, and it may be true for some DSOs, I don't know, but that's something that I think is important that we touch on and talk about. Dr. Hill-Moses, as an associate coming in, what was your experience like with treatment planning?
Sure. I think treatment planning is the most difficult thing to do right after school. So I definitely leaned on my mentors. But like Dr. Meckelberg was saying, you know, they offered me different suggestions and we were able to talk it out. But ultimately, if I thought a tooth was restorable and we needed to give it a root canal and I thought I could pop a crown on there, then that's what I did. You know, it maybe another doc wanted to extract it. I do work in a 2-doctor office, and every now and then we'll see each other's patients. And so if we disagree about something, we just talk about it, and we're very upfront with the patient. And at the end of the day, you know, it's just what is best for the patient. That's all I think about. And it's my license on the line, so I'm going to do what's best for the patient no matter what.
Great, thank you. We do have a lot of questions coming in, so I am getting to them. I don't want you guys to think that I'm not going to be answering them, but I'm just going to kind of try and go in order so that things make sense here. Dr. Hill-Moses, we talked a little bit, we touched on mentorship. Can you tell us a little bit about what your transition from dental school into your practice looked like and how that mentorship worked?
Sure. So for me, the Dickersons, it's a husband-wife team, Dr. Dickerson and Dr. Liu, and they own 14 practices in the Tampa area. So the first basically 8 weeks, I was always with one of them, and it wasn't necessarily in the same office. So it was kind of based on, okay, every population is a little bit different. In this area, this office, they do more dentures. So let's really hone in on all the denture steps and making sure that we get those wax bites proper. We, you know what to look for in the wax try so that when we go to process the denture, the patient's really happy. Then maybe the next week they were like, you know what? We just want you to really focus in on production. Let's like see if they're, you know, as far as fillings, crowns, making sure that you're able to provide the most quality care, but also improving, you know, you're seeing 2 patients when you're right outside of school, so, or right in school, and then outside of school, you're seeing several patients a day. So, you know, are you a bit faster, but still providing the ultimate quality care? So one thing that they had me do was after I completed fillings, I would always take x-rays to make sure everything was, there was no voids in it. So clinically, we were checking my work, so to speak. So the first 8 weeks I was with them, and then I was placed into my quote unquote permanent office where basically I could call upon them if I needed, but I was with another doc in that office as well. So that's when I started seeing, you know, my own patients, the patients that I treatment planned would become my production patients. And every now and then, you know, you would realize I misdiagnosed something, and I would lean on them as far as how to have that hard conversation with the patient. So hopefully that kind of ties in all of the answers there. But a year out, they just spent a week in my office and just helped me coach as far as like my leadership with the team as well. So it's kind of like there's 3 different aspects, the clinical part, the leadership part, but also just making sure I'm okay life-wise.
Great. Yeah, perfect. Thank you. I appreciate that. And Dr. Meckelberg, you have mentored a number of docs now. You own your own practices. So can you walk us through what that would look like, what these guys could expect in their mentorship with a practice owner like you? Oh, I think are you on mute?
I will tell you, yeah, every owner that you meet will give a different answer for this. And you'll feel a different vibe with I love every owner in Florida, but we all do things just a little bit differently. So I can speak for myself, but others might do things with their own twist. So for myself, I like to spend one-on-one time for a minimum of 4 weeks, if not 8 weeks, with every doctor I bring on board. And what I mean by one-on-one time is we are attached at the hip for the entire time frame. Now, does that mean that I'm standing over you while you're doing your procedures? Not at all. But typically what I do is the first week to 2 weeks, I have that doctor shadow me and assist me on all the procedures that we would go through on a day, whether it be everything from implant cases to fillings to crown and bridge to full mouth extractions, everything under the sun. So they can kind of get a glimpse at how I would do it with the patients that we have. Then we transition to that doctor is doing the actual procedures while I'm assisting them for that time frame of 1 to 2 weeks or however long it is, until that doctor feels very comfortable. And then at that point, we start to separate. So I'll still be in the practice, seeing my own patients, but at the same time, they're able to start seeing their own patients and doing these procedures, knowing that I'm there to step in at any moment when they need it. And when they get to the end of it, if they say, hey, doc, how does this look? Do you want me to check over this this full mouth extraction? I'll take a peek at it for you, and we'll see how the sutures look. We'll see how the alveoloplasty turned out. We'll see the crown prep. What are my opinions on it, and what things would I suggest for alterations? Like those things over the next time period. So eventually, when we get to the end of the doctor development period, I would say, like I said, between 4 to 8 weeks, depending on how fast that doctor just catches on. Then it's full steam ahead. And I'll still be in the practice, most likely with that doctor, whether I may be floating certain days to my other offices, but I'm still there consistently. And what I tell my doctors, even for the ones that are my lead dentists in offices, is if there's procedures that they want to expand to, or they're not super comfortable with yet, I'm completely open to them scheduling those procedures when I'm going to be there. So I can go back and assist them on those procedures and get them more comfortable with it on procedures that may be a little bit more advanced, or say they want to get involved with implants. And that's something they've never really dealt with before. So we have an implant day. I'll do that in my practices in Panama City, where I'll go for the day and place implants all day, and we'll bring in the doctor and we'll block their schedule and we'll do the implants together. So they can see it firsthand and we'll get that experience. So the ultimate goal is to allow them to be able to be comfortable with all those procedures that we do. And I'd say that's kind of my side of the mentorship. But like I said, every other owner may be a little bit different. They may be more comfortable with other procedures. One thing I would express is if there's stuff that I don't know, you guys are in school right now. So there could be new technology and things that I'm unaware of. I'm completely open to learning about these things, and even things along the lines of I don't do. So endo in my offices. So I don't do any endo in any of my offices. I refer out most cases to the specialist. It's more personal preference. It's not because we can't do endo. We can, and in certain cases we will if it's an emergency. But I've found for patients, it tends to be a lot more comfortable for them to go to a specialist, have the endo done, and it's done really quickly. They're super efficient. The patient's happy. They come back, and we do the restorative work. However, I have had doctors that are passionate about endo and love doing molar endos. So do they still do those in the practice? 100%. And if I'm not the one to guide them, I want to get them in touch with people that can, or courses that can, or things so you can still pursue all of your passions, not just what my passions are.
That's great. Thank you, Dr. Meckelberg. We actually had a question about endos and extractions, and hopefully we were able to answer that for the student. And Dr. Hilmoses, maybe you can add to that. Are you doing endos or extractions, or do you have specialists in your practice that you're using?
Sure. So we have an endodontist that's in our practice about every other week. And then same thing with an oral surgeon. He comes like every 3 weeks or so. So I throw them cases that I'm uncomfortable with. When I first started, I wasn't doing any of my own endo just because our endodontist was so quick and efficient. I called it crown day, so that she did the endo and then I did the build up and crown, and then boom, next patient. Crowns are one of my favorite procedures, so I loved that. I have done some of the endos. Actually, I had, during Corona, I got to go to another office, which was with my owner's partner. So she's kind of been an awesome mentor for me. And I expressed that I wanted to do some endos. And so she found me some awesome cases and she was like, all right, let's do this. And prior, she had the Wave 1 rep come in and talk to me. And so we did some practice on extracted teeth, just because I hadn't done any since school. So now I've been doing some of the anterior endo, but I usually refer to her if she's available. As far as extractions, I do primarily my own extractions unless the patient wants to be sedated. Most of the wisdom teeth I'll give to our oral surgeon. And anything where there's a good amount of excitosis or implant cases, I'll give to my oral surgeon.
Awesome. That's great. It's always helpful to have those in-house if you do have them. Not every practice has an oral surgeon or an endodontist, but many of them do. Dr. Meckelberg, I want to go back to a few things that you had talked about. You are well known within the Aspen Dental family as a really, really good mentor. And I do have a lot of these guys asking me questions about the application process. If someone wanted to work with you or a practice owner within Aspen, when would you say is a good time for them to start looking into opportunities?
Honestly, I would say immediately. Get into practice and see. If any of you that are watching are interested, the invite's out there. If you guys want to come and spend a day with me, whether I'm at this location or my location's in Panama City, or the beach office is probably the most convenient because you're pretty much overlooking the water. And that's close to you guys, I know, in Lincoln. So we can always plan around that. But if anybody wants to see it and just see how we work, what the flow is, and what Aspen is about, especially in my locations, they're more than welcome to. And I do encourage you, from what I understand, everyone's a D4, right? So they're moving into that.
I think we might have a few D3s in here.
Okay, so that's even better. I was going to say, the sooner the better. I think that was my one regret in dental school in regards to finding where I was going to fit in most with my future career. Was I was very closed-minded and I didn't look outside of, what I had my mindset on. And I think getting into practice is one of the most important things. So open invitation if anybody wants to come and spend some time with myself. I promise it'll be a fun day. We have a blast in my offices. So
that's a really big offer, especially because, like I said, you do run a really great mentorship, and these guys would learn a lot from you. So definitely take him up on that offer, guys. And I want to just mention I'm having a lot of questions about career path and the trajectory from associate to lead to owner, and we will get to those. But I'm also getting questions that are more clinical, and I kind of want to stay on this topic for a minute while we have the time, so we're not jumping around. I wanted to go into a few of these questions that we're having about some of the things you guys mentioned. So implants. I know that you are personally placing implants, Dr. Meckelberg. Is anyone else in your practice doing that with you, your leads or your associates?
Not as of yet, but we are on the path for actually two of my doctors. So one is super interested, and we're going to get him out to a course relatively soon. There's a really neat course that Aspen offers that's kind of like the second level of implants. Now, the first level, I bring all my doctors, or I should say I brought all my doctors to Chicago pre-COVID in February, and we actually had a implant symposium, I guess you could call it, but it was a full weekend event at Aspen's training center. So Dr. Rawal is the head of our implant department for Aspen. He's an amazing, amazing surgeon. And he's actually based out of Orlando, but he runs everything for us and really helps us build the cases and really our knowledge base on it. So we were able to get everyone together. We did this course for 3 days up in Chicago, learning on the restorative portion of implants, learning about how to best prepare sites with bone grafting and membrane placement, how to select cases for implants. So a lot of the basics of it that you really have to have a strong foundation to move past that. I think you really need the case selection is one of the most important things that can be very overlooked. You can have a perfect implant placement, but if it's the wrong patient and the wrong case, it doesn't turn out well. And there's a lot of factors that can determine that. So getting the basics down is super important. And once those basics are down, and then my doctors, the way that I tell them is once they've restored a certain number of implants and they're very comfortable doing that, and they know what to look for in implant placement, where to put the implant, how to place the implant, what is easier and harder to restore, then when they're actually doing it themselves, they have that in mind. And they also know the process, so it makes it a lot more simple.
Awesome. Yeah, great. Thank you for that. And Dr. Hill-Moses, maybe you can kind of piggyback off of that, because I know you had a similar experience, not with implants, but when you came on to your practice, you shortly thereafter were trained with Invisalign, which is also kind of an exciting thing that we've rolled out within Aspen. Can you tell them a little bit about that training?
Sure. So with Invisalign, we have a weekend, also pre-COVID, called Lift, where basically we worked with the doc who helped treatment plan the majority of the Invisalign patient cases. So we basically looked for some key factors as far as would they be a good case selection for Invisalign. I think one thing that patients often think about for Invisalign is like, oh, it's just an aesthetic fix. Well, you realize all these different diagnostic reasons as to why you would do that and why you would even suggest Invisalign to another patient. So I've had patients who would have never considered Invisalign, but because they're showing early signs of periodontal disease, and I explained those key factors, which I learned during Lift, they are now in treatment and helping fix their bite and alleviate periodontal problems. So I think ultimately it's been really cool to take pictures and showcase those cases that I've completed already. A lot are still in progress, but it's been really neat to see.
Awesome. Thank you. And you were trained in that pretty quickly after you started. What was it, like the first 6 months or so?
Yeah, I think it was like the second month actually. So pretty quickly. And then now I think they're doing everything online. Because I know as far as what Dr. Meckelberg was talking about for the implants, as far as like restoring and everything, when dentists could only provide emergency care, I did a lot of CE on that, which was all free via Aspen, which was really awesome. And it's something that I use pretty regularly in my office.
Awesome. Great. Thank you so much for telling us about that. I have been getting a lot of questions about, like I said, that trajectory within practices. And I know that kind of looks different for everybody. Dr. Meckelberg, can you kind of talk about, you very quickly moved into ownership. Can you kind of talk about that process and how that looked for you?
Definitely. So for me, I expressed very early on that I wanted to become an owner and a multi-practice owner. And I think Aspen was really good about getting me in position with mentors that would help me get there. My mentors were absolutely incredible, and they're still guys that I call regularly to get advice on not just anything clinical, but also practice management and how to run not just the business, but also how to build your teams, how to hire, how to fire, all the things that you're never taught in dental school. The business background. It's something I've always been passionate about. My background personally is in business and economics. I love that side of things. And we didn't get a lot of that in school for dentistry. And so to be able to apply it, a lot of it is learned by example. And so I was able to have great mentors throughout the state of Florida that I train with that helped me. And a lot of those guys, and some of them own 20 practices. Another one owns 5 going on, I don't know how many. He's probably going to buy a bunch more this year. So these guys they're very seasoned, extremely successful. And that's what helped me get to that point. Now, when I came out, I did start as an MCD or a lead dentist in an office. I expressed early on that I wanted to grow. And so they put me in an office kind of to see how it would go and how I would do. We were fortunate enough the practice was very successful. This was in the Chicagoland area. And shortly after that, I heard of an opportunity in an area that was underserved, and that happened to be Tallahassee, which was North Florida was an area that I would really like to move to. So I had been reached out to about the opportunity, and I think that's one thing that I will encourage you guys, if you're really interested in ownership, seizing those opportunities in areas that may be newer or may not be the most desirable right now. You can really build up practices that way. And that's sort of what happened with Tallahassee. Was I came into an office that was struggling. We didn't have a very good team in place. The doctor was struggling. She was younger, kind of unprepared for being a leader in the practice. And they needed someone to kind of step in and grab the bull by the horns. And I was really eager to do something like that. So it was just fortunate that happened to be at the right place at the right time and grow. And that was how I ended up having the trajectory into owning a practice. Now, I will say Florida's a little bit tricky, and it's its own can of worms in that Florida is very saturated in a lot of different areas, not just Aspen, just in general, dentistry-wise. A lot of Florida is very saturated for dentistry, but specifically for ownership opportunities. And that's why I encourage a lot of you, if you are looking for ownership opportunities, that's not to say you can't practice in Florida. I have a lot of docs that have expressed that to me. Someday they want to be an owner or a partner. And that's my goal, and a lot of other owners' goals, is we want to find amazing doctors that we love to work with that eventually want to partner and want to join us in our group, that we can still always be there to support and grow and provide resources to, but then they have their practice, that's their baby. And we're there on the sideline rooting them on and helping in any ways that we can. I also have doctors that they are passionate about growth and expansion and are ready eventually to move on to it. They're open to moving to a new area. It's like I said, Florida's a little bit saturated for direct growth, for coming out and saying, oh, I want to own a practice tomorrow. Most of the locations in Florida are, for the most part, are owned, but that's not to say that partnership isn't an opportunity that's available. And also I encourage all my doctors, if they want to be owners and they want to own multiple practices, let me help you get there. Let me help you grow and really build your knowledge base up and your skill set and your ability to run and manage a practice, so that when you're ready to take that step, whether that be moving up to, North Carolina, or moving out to California, or moving somewhere different, to have that opportunity and to build and own multiple practices, then you're prepared and you're ready to just seize it.
That's great. Thank you, Dr. Meckelberg. I think that gave them a lot of information on ownership. You did mention partnership. Do you have any partners currently in any of your practices?
I don't yet, but I think typically most owners, when they want to have that right doctor, and I already know, I have in mind some of my doctors that I've been thinking about down the road offering partnership to. Obviously you have to have them, and for an extended period of time, have great success and show that they can run and manage the practice. That's one of the unique things for me, was that everything happened so fast that I haven't really had as much time to really see how these doctors can do. Because a lot of these doctors that I've only had on board for a year, and they've quickly moved up and done so well. But we want to be able to get to the point where, and my thing is with partnership, is when I partner an office, I want to feel comfortable that that office can completely run. If, say, I were to step away and only be there one day a month or one day every 2 weeks or whatever it is, that office won't take a significant step back. And once we get to that point where that doctor is doing extremely well and the office is crushing it and the team loves the culture, everything about it, that's the point where I say, you know what, let's do this. Let's partner. Let's do this together. Let's work together. I'll be a resource to help you in any way that I can. And I'll still have my hand in things, but I want you to be more of a decision maker than what you are right now, and really to help to grow these practices.
That's great. And now with your practices, I have been getting a couple questions about the financial side of that. Did Aspen help you finance these practices so that you can open more than one, or so you can be an owner so shortly after graduating from dental school?
They did. And thank goodness they helped, because I don't know for anybody that has student loan debt, I came out of school just like swimming. From undergrad and dental school. It's not fun. It's not cheap to come out of school with all the loans that we've had accrue. But at the same time, that's something that Aspen did help with. We don't take out loans directly from Aspen, but they have resources to get us in contact with banks that will allow us to take out loans. And I will tell you, it's awesome, the setup that they make it so easy. Really, really easy. So it was a very smooth process in the practices that I've bought and the practices that I will buy. there haven't really been that many hiccups.
That's great. Thank you for that. And Dr. Hill-Moses, is there anything that you want to add on just, associate to hopefully one day, lead dentist in a practice, what that looks like in your area? You're in Tampa. It's kind of a little bit more of a saturated area, and everybody wants to be there. So it might be a little bit harder for an associate to move up to an owner so quickly. But anything you want to add on?
Yeah, I think for me, I'm kind of closed-minded with geography of where I want to be. So I think the ultimate goal would be partnership. And one of our docs recently partnered with the Dickerson. So I've kind of leaned on her as far as like what that would look like and how she got there. And her motto is just work hard. If you want something, I think if you work hard and you show that you have a good work ethic, then you can get there for sure.
That's great. Thank you. And I have gotten a few questions here regarding, what the payment structure looks like. So Dr. Hill-Moses, do you mind jumping on this question regarding what an associate would make out of dental school? I can help out too. I maybe have a more general idea, but just for you and your experience.
Yeah, so basically what we get is a daily guarantee, and I think that's kind of regional and dependent on where you practice, what that exact number would be. And then at the end of the month, you'll get a percentage of your production. So let's say that one day I see 3 new patients and it was just a slower day for production. I did 2 crowns. But then the next day I did 8 crowns and a bunch of fillings. I'm still going to get the same daily draw, so to speak. But then at the end of the month, it'll even out with that percentage based on just, how much your patients have enjoyed your quality care. So there's a survey that's sent out and that helps determine the percentage. Molly could maybe give some more exact numbers. I'm not really sure, but that's basically how it works.
Yeah.
It's kind of, yeah.
So on average, I would say a new graduate, depending on where you're looking to go, is looking at about 600 daily guaranteed rate, 650. But again, that does depend on where you're looking to go. It can go upwards if you're willing to go to an area that maybe is harder to fill. But that kind of helps guarantee you for no matter how, like Anna Hill-Moses said, like Dr. Moses said, for no matter how many patients you see a day, you will get that guaranteed daily rate. And then Dr. Muckelberg, maybe you can talk a little bit about what that structure is like for your incentives. I know it's a part of it is based on your patient satisfaction ratings.
Exactly. So that's one thing that I really like about how Aspen has their model set up. And it's actually not based solely off of your production. It's based off of the entire office. So it's a team atmosphere. And so when a patient accepts treatment and has their SRP done, or when a patient accepts treatment and has their OS comes in and they do all their wisdom teeth, all those different things will factor in together at the end of the month. And then you'll receive a percentage of the total office production at the end of the month. And that percentage is typically dependent, and there's a sliding scale on a few different factors, but the biggest factor is actually the patient satisfaction score. And what that means is, are patients saying, heck yes, I want to refer you to my friends and family? Are they giving us good reviews? Typically, it's based off of a 5-star review. And like I said, that sliding scale for associates is anywhere between 8 to 10% of the total of the practice. Whereas for lead dentists, it's anywhere between 16 to 20%. So a pretty big jump when you go from an associate to a lead dentist. Now there are some caveats to that. In the associate production line, it doesn't factor in some of the things that it will for a lead dentist, because a lead dentist is also going to be, we call them the managing clinical director. So the MCD, I'll refer to them as in the practice. The MCD is the one that's going to manage a lot of that practice for the staff and the overhead of that practice and the supplies that are being used. So not to say that the associate doesn't have a big say in that and doesn't have a factor in that, but the managing clinical director is directly responsible. So therefore, those actually play a factor in what comes out before that bottom line revenue number is calculated for the MCD. So it's not exactly double. Included, I will also say included in that is the associate's pay. So for the MCD, that is taken out as well. So it makes it a lot more similar to if that that managing clinical director, or MCD, is the one that's they're running the practice, they're managing the overhead there, and that includes doctors, that includes hygienists, that includes the oral surgeon, that includes their assistants, their front staff. All those different things factor in. So that's one thing that I love about the structure is if you do really well as a clinician and you love doing that, especially coming out of school as an associate, you can do great because you don't have to worry about all that stuff. Now you can learn about all those things, and when you're ready to move into that lead dentist or that MCD role, then you'll have that great knowledge base. When you do come into it, you're able to just hit the ground running, and that's going to accelerate what your growth potential and what your compensation potential is when you're in that lead role. And then eventually, whether you decide to partner or own or whatever it is, down the road, then you have that skill set and it best prepares you.
That's great. Yeah. Thank you, Dr. Mecklenburg. That gives us a nice, clear understanding of how everything works. What do you look for in your lead dentist?
I would say so in general, I'll say anybody I bring into my practices, the most important thing to me is positivity. Someone that is a glass half full type individual. I don't like pessimism. So that's one of the most important things. But I would say the jump from an associate to a lead dentist, it's in the name itself. I would say it's the biggest factor, and that is leadership. Being able to manage an office, being able to lead a staff and motivate. When someone comes in and they're upset about something and they're complaining about another staff member, how do you handle it? How do you handle that situation? Do you bring them into the same room together and sit down and be able to talk through it? Or do you feed into any sort of drama that may cause? How do you relate to your office manager? Are you able to sit down with that person and tell them, I need you to do the X, Y, and Z a little bit differently. I think this is how we're going to be able to move forward and just make the practice that much stronger. Those are factors that allow doctors to jump from that associate role to that lead dental role. Also, alongside that, obviously the clinical side as well. The lead dentist, I do look for someone in the practice that can handle I won't say every case, but the majority of the procedures that come in. Now, there still may be cases, and I have with my lead dentist right now, there are still cases that they plan on days that I'm there, not including implants, but also we're talking about doing a full arch with bilateral tori removal, and these tori are the size of golf balls, and they've never done anything like that before. So we plan accordingly. I'll be there that day, walk them through the case. How are we going to do this? Well, maybe I'll start on one arch and we'll do, or I should say one side. I'll do a side and they'll do a side. So they're comfortable with seeing everything. But that's one of the biggest factors is also being able to support and build another doctor under them. Because realistically, I love to have two doctors in practices. I love to be able to have that atmosphere where you can bounce ideas off each other consistently. And the lead dentist needs to be someone that's strong and can support the practice from a management side, but also lead the practice and motivate and build the culture within an office. So your team members want to come and show up every day, and your associate loves working with you and wants to be more like you.
That's great. And now on the other side, what about for an associate? What would you be looking for in a new graduate, for example, who's coming in and interviewing in your practice?
I would say 100% someone that is coachable, someone that wants to just soak information up and run with it. I prefer someone that's not timid. Now there's a fine line there. There's a fine line between confidence and arrogance. It's kind of that you definitely want to be in the confident side, but in order to be confident with something, you really have to understand the why behind it and why you're doing it in the basics. So I think bringing someone in that is just eager to learn, wants to just soak things up and then hit the ground running, and know that they have someone behind them that's going to support their decisions and help them through those difficult cases and those difficult procedures. So that way, 6 months, a year down the road, we're like, hey, we have this opportunity here. Let's get you in a lead dentist role so you can utilize those skills and be able to start to teach others how to do these things.
Great, thank you. And Dr. Hill-Moses, maybe you can answer this question for us. What were some of the greatest challenges that you had coming out of dental school as an associate, and how did you kind of work through them?
Sure. I think the biggest thing is just open communication with your mentors as far as what you're comfortable with, what you think you're clinically really strong at, and where your clinical weaknesses are. So I know for me, out of school, I didn't do more than 4 extractions at once. So to say like, oh, here's a full mouth extraction case with alveo, you have 2 hours, that was pretty overwhelming to me. And so, like Dr. Meckelberg did with his associates, the Dickersons, would do part of the mouth and I would do the other until I felt really comfortable. The other biggest struggle, I think, is just coming up with a comprehensive treatment plan quickly. Because you are seeing, you might be in a crown prep and perhaps it's time to pack cord, which your dental assistant can do, and there's a new patient ready for you. So reviewing those x-rays, knowing it's okay if my patient waits for a minute while I prepare, so that I know when I walk in there, kind of a generalized plan, I have an idea of where I'm going, but I'm also going to have a conversation with the patient so that they understand why I'm suggesting this, and we're coming up with that plan together. So those were the 2 hardest things, and just keeping an open line of communication with my mentors, saying like, hey, I'm not quite comfortable with this procedure yet. And still, I'm not super comfortable with bilateral tori removal. So anytime I'm doing one, I make sure that the Dickersons are in the office with me. And it's gotten to the point where they're assisting me, but I just kind of want them there to be like, yep, you got this, Anna. So
do they work around like if you have a case that's coming in and you know that you're going to need their support, will they come into the practice to help you with that?
Yeah, so usually I'll see during the new patient exam, and I'll shoot them a text and just say like, hey, I'm treatment planning this. I have the patient lined up for, the first step. When can I schedule the surgery? When are you guys available? And usually they'll reply pretty quickly by telling me a date, and then that'll be like their day in the office. And so then if there's any other cases that month, we just schedule them that same day.
And how did it work with the lead in the practice? Did you have the lead in the practice to kind of help you out when Dr. Dickinson wasn't there or his wife wasn't there?
Yeah, so I'm actually in a unique situation. There's 2 associates. So neither of us are a lead. But basically we just call upon the Dickersons. They're at our I don't know what saying I'm trying to say.
I can call.
Yes, exactly. And there's been times where, we've seen something that's on the schedule and we'll just give one of the other docs a quick call. We're like, hey, we're pretty comfortable with this. We just want to confirm like X, Y, and Z, because the doctor that had treatment planned that is now in another office. So that's really, really easy. So.
Great, thank you. We only have a few more minutes left, and I want to be respectful of everybody's time. A lot of the questions that I've sort of been saving for last are more along the lines of advice questions. I've been getting a ton of advice questions that I don't always get on these, or I didn't get on my first 2. So it seems like these guys are looking for some advice on, what can you offer them when they're looking for their first opportunity after dental school? If they're interested in Aspen, what would be your first piece of advice to them? And Dr. Meckelberg, maybe you can start us off here.
So advice-wise, I think we talked a little bit about it before, but I think the biggest thing is getting into the office and shadowing. Really seeing if you're going to fit in well into what is going on within the practices, and also mesh well with the mentor doctor you'd be working with. I think making sure you spend a little time in whatever area you're planning on living in, and making sure that that's somewhere you could see yourself, at least in the short term. And along with that, I just think having that open-mindedness when you come out, that you can come out and just not necessarily know what's going to happen next, but have confidence in what you're going into and excitement. I'll tell you, coming out of school, it's scary when you come out and for the first time you're doing procedures by yourself. Just knowing that you have somebody there to support you, and knowing that you have somebody that really has your best interest in mind and wants you to succeed and is in the practice with you on a daily basis, I think that makes a big difference. So no matter where you go or wherever you decide to go, make sure it's a place that has that, and that has that mentorship and someone there to help you.
Would you say when you're interviewing a new associate, is there anything specific that you like to see them have, or that helps to make them stand out from others, in terms of like cases that they've done during dental school or experience that they've gained from dental school?
Clinically, I think I will say most things you'll learn when you're out in the real world, because honestly, most of the stuff that we learned in dental school, it's kind of the bare bones basics, and it's in the exact way that by the book you have to learn it. In the real world, things are not that hard. It's a lot easier when you get out in practice, and how to take out teeth and how to do dentures especially. Dentures in school were my least favorite subject. I hated removable pros. And now it's like you have an in-house lab that does 98% of the work for you. And so it's a matter of looking for the little caveats and little things that you can do to make that denture fit and feel and look that much better. But kind of full circle on that, I think there's a lot of things that you don't learn in school that you don't necessarily need to know right now. And when you get into practice, you'll learn those. But I would say if there's anything in your last few years that I would advise, one is enjoy your time in dental school, honestly, because I look back on it and those were the best 4 years that I never want to live again, but definitely enjoy them. But secondly, I would actually advise you to push yourself. In dental school, you have professors there. So worst case scenario, something happens and you don't feel comfortable with it, you have someone over your shoulder that can help you. Not to say that's what we want to provide when you get out, is that you have that support, but push yourself in dental school. Why not? Surgery wise, that's the biggest one, and the biggest thing that I'm thankful for is my background in dental school was I finished my requirements a little bit early, and I just lived the last half of the year in the OS, I guess you could say, with the OS faculty, and just spending time getting to know them and doing cases with them. And that was something that gave me a leg up coming out, being able to be comfortable with doing surgical extractions or doing full arch extractions. I had done a few full mouth cases in dental school. So when I did come out, I wouldn't say I was a wizard or fast at it by any means, but I felt at least comfortable enough to treatment plan those patients and be able to talk to the patients about what to expect. So that's something I would encourage in school, especially with Aspen. We do a lot of surgery. We see our patient population is a population that hasn't been to the dentist in 10 plus years, the majority of them. And so a lot of them do need a significant amount of periodontal work and a lot of surgery. So if you're anyone that loves surgery, there's no shortage of it. I promise you will not be bored. And the neat part about that too, and why I love OS so much, and why we do a lot of it in my practices, is it's immediate gratification because you see the result in that room within the span of just a matter of hours. And that's the neatest part, is you see somebody that comes in and they haven't been able to smile for years. And all of a sudden you do this surgery, you do a full arch surgery, you place a couple implants in, you put the overdenture, or I should say the healing denture in. and they're looking in the mirror, and some of them are crying. Some of them are so just excited that they actually have a smile, and that difference you've made in their life, that's what makes it worthwhile. So I highly encourage you, kind of going back to that, do as much as you can with surgery in school. But if that's not where your passion lies, that's okay. There are a lot of Aspen dentists that are super successful, and that's not where their passion lies. But I would say for my practices, what I would encourage is definitely along the lines of surgery. North Florida, there's plenty of it. So.
Great. Yeah, that's very true. I've heard every practice is a little different in terms of what types of cases you're going to be seeing, but thank you. That was really great advice for these guys. And I think they're very interested in hearing what your opinion is on what would make them successful in the interview process and well looking for their first opportunity. Dr. Hill Moses, do you want to give these guys a last piece of advice?
Sure. I guess as someone who, graduated within the past year, from just an organizational standpoint, I would definitely encourage everyone to just have your resumes ready to go, update that. And if you're speaking to younger students, I would say tell them to make that D1 year. And so they can update it throughout the process. And dental school is the time for learning. So, I wish that I had been a little bit more active, in different discussions as far as treatment planning, and just trying to think on a little bit more independently than having my clinical instructors say, you know what, no, that one doesn't need filling, that needs a crown. Well, why? Learn the why, so that then when you're outside of school, when your patient's asking you, but why can't you fill it? You can confidently explain that, and you have the different words that you use for patients to understand that. So I would say, enjoy your time, don't stress, you're going to be awesome, and you'll find the right place for yourself.
That's great. Thank you both. Thank you for being here tonight. Thank you for answering all of the questions that we had. And I do want to just mention that I will be following up with everybody on that participated tonight with information on, how you can get more questions answered. Dr. Meckelberg has been nice enough to extend an offer. If you guys are interested in talking with him further, I can try and get that set up. My recommendation to you guys would be, if you're looking for one of these great opportunities that both docs have been talking about, be open to location and finding that right mentor. So I can work with you guys to find the best mentor for you. And I think these guys both gave some really good information for you guys to work with right now. Again, I'll be following up with everybody. Dr. Meckelberg, Dr. Hill Moses, thank you so much for joining us. This was a really great session. I said at the beginning, 3 is my lucky number. So it was lucky number 3. If you guys need anything else, please don't hesitate to reach out. Again, I'll be sending a follow-up email. And we look forward to seeing you guys at our next Ask Me Anything. Thank you, guys.
Of course. Take care, Molly.
All right. Take care. You guys have a good night.
All right. Have a good night.